So in your case last week, we talked about the axillary nerve, we talked about the musculocutaneous nerve, and we talked about the suprascapular and upper and lower subscapular nerves. But today we're going to finish off talking about the brachial plexus by talking about the branches that go farther than just the brachium. So we're talking about the ones that go down into the antebrachium and the arm. And the first one we're going to talk about is the median nerve. So you can see that it generally follows the course of the brachial artery and it enters the elbow medial to the biceps tendon. And then once it gets into just slightly proximal to the interosseous membrane, it gives off a small interosseous branch. And that's the one just there. And this interosseous branch will go to the deep finger flexor muscle. So it will go to the flexor digitorum profundus muscle. Now the main part that you can see here continues to travel down through into the carpal tunnel, and you'll remember that it's deep to the flexor retinaculum, in with the tendons of the flexor pollicis longus, flexor digitorum superficialis, and flexor digitorum profundus. Once it emerges from the carpal tunnel, then it's going to supply the wrist and the finger. It's going to supply the thumb muscles and some of the intrinsic finger muscles. Cool. Pathway of the ulnar nerve. The ulnar nerve, as it goes down, it actually follows along the similar pathway to the median nerve, along the medial humerus. Now, what's interesting is that as it gets towards the epicondyles, it takes a very posterior path, and it goes posterior and lateral to the medial epicondyle. As it continues down through a little canal, and it emerges through the canal. Sorry, I just had a mind blank. It's called the cubital tunnel, and as it goes through the cubital tunnel, it will emerge into the ulnar side of the antebrachium. And then it travels on the medial aspect of the forearm. It supplies some of the flexor digitorum profundus, and it also supplies the flexor carpi ulnaris here. But most of the action is in the hand. So as it comes down over the carpus, it passes through a little canal called Guyon's Canal, or the Tunnel of Guyon. Remember, just deep to that piezohamate ligament that you can see there. And it's going to supply the many small intrinsic muscles of the hand. And it's also going to supply some of the skin of the hand as well. So if we look at how these are actually organized, what you can see is that from anterior to posterior, we have the musculocutaneous nerve. Then if we move medially, you'll find the median nerve. And if you move further medially and posteriorly, what you'll find is the ulnar nerve. And that sort of makes sense because the musculocutaneous nerve is going down to supply the biceps, which are a really anterior structure. Median nerve is going to come medially and then slightly anteriorly again to supply the forearm flexors. And then the ulnar nerve doesn't do anything whatsoever in the brachium. It just needs to reach its little cubital tunnel at the antebrachium. Cool. So the axillary nerve we've talked about previously, going to supply the deltoid and teres minor, but the radial nerve we haven't. So the radial nerve is going to arise inferior to the axillary nerve. And have a look at the wet pot of this, the wet specimen of this in the lab, and you'll see from memory, number 16 on that wet pot, you'll remember that they're all numbered, is the axillary nerve. And I can't remember what number the radial nerve is, but you'll see that 16, the axillary nerve, is superior to the radial nerve. And the reason is because everything the radial nerve needs to innervate is inferior to what the axillary nerve needs to innervate. Nice. Cool. So the nerve spirals around through the humerus along the spiral groove, And as it does so, it gives off 3 different small branches. So it gives off a branch to the long head, gives off a branch to the lateral head, and gives off a branch to the medial head, as you can see here. And then it looks like it's just about to sort of head over to the flexor compartment of the brachium, but surprise, surprise, it doesn't. What it does is it actually goes and it slips under the brachioradialis, so it really stays as a posterior structure. And at the brachioradialis, it gives off a small superficial branch, and this will be a sensory branch, and that's called the superficial radial nerve. As it comes through into the antebrachium, it gives off a branch to the brachioradialis, and now once it's done that, it crosses through the supinator and it gives off a branch to the supinator, and it says, here you go, you can have some. And once it comes through the supinator, we don't call it the radial nerve anymore, we actually call it the posterior interosseous nerve. And as the posterior interosseous nerve dives through into the antebrachium, it's going to supply all the posterior forearm muscles, all of the posterior forearm muscles of the forearm and hand. Okay? Now, if you have a look at this branch, this is the superficial radial nerve here, and this is going to the hand, yes, but the radial nerve doesn't supply any intrinsic muscles of the hand. All it does is give this sensory branch, the superficial radial nerve, to the hand. So the radial is only sensory in the hand. There's no motor function of the radial nerve in the intrinsic muscles of the hand. All of that is being done mostly by the ulna and some of the median nerve as well.